Hello, and welcome to another Advanced Rheumatology and Arthritis Wellness Center forum. I'm Christine Matelan, Practice Administrator and Certified Research Coordinator for the office. I've been with the practice for 15 years, and a very large part of our medical office revolves around wellness. Today I'm joined by Rosemary Altemus, nutrition counselor for the practice. Many of you may be familiar with Rose because you've either already had a consultation with her or you've been on site prior to COVID for our anti-inflammatory cooking classes, or you've watched her on YouTube. She's also our expert with CBD oils, creams, edibles, and patches. Today's forum is one of my favorite topics, nutrition. I've personally had a consultation with Rose and have tried her detox diet, which we'll talk about later. As a few years ago, I was having severe problems with my stomach and couldn't really eat anything. And being a breast cancer survivor, talking to Rose, we realized that the medication I had been on for 10 years to keep me in remission was building up in my liver more than likely. And so I detoxed for 30 days, realized what foods I could no longer enjoy or that I was allergic to. And since then, I've been following the paleo diet 80% of the time. So, Rose, tell us how you got involved in nutrition.
I love nutrition. I love to help people. I like to see them well. I worked with functional medicine doctors and chiropractors for over 8 years, and then I got my certification in food health and nutrition. I've been here at the office for over a year and a half and loving everything that I do.
Okay. So, with any medical condition, diet and nutrition can play a major role in minimizing symptoms. Tell me what's most important about an anti inflammatory diet in a rheumatology patient.
An anti-inflammatory diet can definitely help patients manage their pain. Of course, you want to speak with your doctor about any kind of new diet that you start or a detox, but it can greatly help because you're eating whole foods, usually fresh foods, vegetables, nuts, seeds, and great meats, some organic meats, fish, chicken, that sort of thing.
Okay. So, in our field of medicine, rheumatology, many people automatically think we only see rheumatoid arthritis patients or, quote, arthritis patients, when our specialty can also include conditions like psoriasis, psoriatic arthritis, ankylosing spondylitis, lupus and gout, diabetes, obesity, uh, gene mutations, lupus, osteoarthritis, and of course, thyroid disease. What are good, healthy food choices for almost all of these conditions?
All of these conditions, a person should be on a healthy diet. If you go to the store and you see the ingredient labels on the foods that you're eating, if they probably have more than 4 ingredients, they're probably very highly processed. So we want you to stay away from highly processed foods. We want you to eat whole foods, organic when you can, fruits, vegetables, beef, chicken, fish. Those are all good things for you to put in your body. And I always tell people, if it comes in a bag, box, or carton, chances are it's been highly processed. So shop on the outside of the store, and chances are that you'll be eating healthier foods. They also help to manage your pain quite a bit when you eat those kind of foods instead of the processed ones.
And so people think, okay, I'm going to have to go to a Whole Foods or a Trader Joe's. That's not necessarily true,
No,
correct?
that's not necessarily true at all. You have local butchers that carry high quality meats. A lot of grocery stores are now carrying, better quality foods, a lot of organic foods. And just because the food says it's organic doesn't mean it's good for you. But, there's a lot of things to consider when you go shopping for your food today.
Okay, Rosemary, I'm going to name some foods that probably everyone has in their refrigerator or pantry.
Mm-hmm.
And I want you to give me the healthy anti-inflammatory alternative.
Sure.
So let's start with white table salt.
White table salt. White table salt's very highly processed, and a lot of times they add iodine, so people think, oh, well, I have to eat white table salt to get my iodine. That's not true. The best salt for you to purchase would be pink Himalayan salt or a sea salt. Those are things that have minerals that are that our body needs, very trace minerals that our body needs, where the white table salt does not contain any of those. It's been processed out.
Okay. How about vegetable oil for cooking?
Oh, vegetable oil. Vegetable oil has come a long way. It's been so processed, so many of them. The vegetable oils, the corn oil, canola oil, sunflower oil. If you have those in your cupboard, you need to get rid of them. The healthy alternative would be, of course, your extra virgin olive oil. Avocado oil now is in the market. It's you can find it readily, and coconut oil. Pick a better quality coconut oil that's not been processed too much.
Okay. How about when you're cooking and we want to add some flavor, Worcestershire sauce, soy sauce?
Mm-hmm. An alternative to both of those would be, I would say, coconut aminos. If you've never tried those, they're delicious. A little on the sweet side, but taste very similar to soy sauce, so you can use those in stir fries.
Does it taste like coconut?
No, it doesn't at all.
Okay. How about white sugar?
White sugar. It's the devil. You want to stay away from white sugar. White sugar has been highly processed. You want to stick with more natural sugar alternatives, and that would be honey or grade A maple syrup. And there are out there a couple alternatives to sugar that have that don't have 0 calories and don't make your I can't think of the word. That make your blood sugar go up. So what you want to do is you want to try those, and that would be monk fruit, swerve, or stevia. Those are new, and you can find them readily at the stores now.
Okay. How about yellow salted butter?
Yellow salted butter. Butter is great for you. However, I would tell you to purchase a grass-fed butter. It's much healthier than some of the other more processed butters in the stores. So get grass-fed butter. A brand name to look for would be Kerrygold. It's very good. It's from Ireland, and it's very, very good butter. Delicious. And another thing you can have too is ghee. Ghee. You can find that in the grocery stores now. I'm sure you've had ghee if you've had lobster and you dipped it in that. It would look like butter. It's clarified butter. And if you're allergic to milk, you can usually have ghee because all the milk solids are taken out.
Okay. How about mayonnaise?
Mayonnaise.
Do you have any alternatives?
There are alternatives to mayonnaise. What you're going to look for is an avocado, one that's made with avocado oil instead of the cheaper oils, which would be, of course, canola oil and that. You want to stay away from those. But I would look for an avocado mayonnaise. Organic is probably best to buy, and they do have them out there.
So basically, just a few changes in our diet is not going to make all the pain go away, but it will help lessen the inflammation.
Absolutely.
And with any change in diet or new diet, you should check with your physician first. And of course, as Rosemary said, she's going to check and see what kind of medications you're on as well, because not every diet is appropriate for every person. With that in mind, what about turmeric? Dr. Stupa is a big advocate of turmeric. In fact, we carry the Young Living turmeric tea, and a lot of people like to have a cup before they go to bed, and they put half of a CBD honey stick in it, and they have a very restful sleep.
Yes.
So tell us a little bit about turmeric.
Yeah, turmeric is a wonderful spice that's anti-inflammatory. If you've eaten Indian food, chances are you've eaten turmeric. Something that makes turmeric work also is pepper. So when you cook with it or whatever, I'm sure there's probably some bioperine in here that helps it to the action of the turmeric to work. The CBD honey sticks, fantastic. These are each stick contains 10 milligrams. I don't know if I can get this open, but it's like they're like little sticks, and each one contains 10 milligrams of honey and CBD. So what you're going to do is you're just either going to suck this out of here, or you can actually cut it open and put it in there. We also sell it in like a little honey bear. You put a teaspoon in your tea. It will help you to relax. 30 minutes before bed, excellent.
And of course, you want to be careful using any CBD
Absolutely.
internal product when using alcohol.
Yes, we have done a video, the good, the bad, the ugly of CBD. If you'd like some more information about the CBD products that we do carry here and some more detailed information, you can look at that video as well.
Okay, so we talked some about turmeric. Tell me about nightshade foods.
Nightshade foods. Nightshade foods are potatoes, peppers, eggplant, and tomatoes, which everybody loves to eat, especially this time of year. They can be very inflammatory to your body. The nightshades can. Not to everyone, but in some people, nightshades can cause inflammation. And so with people, once we get everything, we do the detox and they're still having some issues, a lot of times we'll pull those vegetables out of your diet and then for a couple weeks and then reintroduce them to see if there's any problem.
Okay. So we treat gout patients here as well. Is it a wives' tale that cherries can help?
It's not a wives' tale. As a matter of fact, it can help. A buildup of uric acid is why you have gout. And so fresh fruits and vegetables are great, but you must really be careful with high fructose corn syrup, processed foods, and alcohol will flare up gout very easily.
Okay. So we've been talking about the detox diet. Tell us what it involves. Tell us what kind of foods we're going to eat, what we're not going to eat. Are we going to take any supplements? Obviously, you want to check with your PCP or your physician here at Advanced before starting any type of diet or detox. And you also want to make sure that Rosemary knows what medications that you're taking, because we do have some patients that have heart disease as well, and you could be on Coumadin or blood thinners, and we want to make sure that we're not putting you on a diet with foods that are going to make your blood thinner, right, and therefore your proton goes out of whack. So
yeah, and that we were talking about that. If you get into our website, there we just did a talk on the good, the bad, the ugly of CBD. So that's something that you really should consider looking at. Especially the drugs that you're taking. We will take a look at that and let you know whether they're compatible. But the detox itself is a 30-day detox. The first thing you do is just make an appointment with me for a consult, and we'll go over your health history and the medications that you take, and then we'll decide, and you can let me know if you'd like to participate in it. It's $35 for a consult, and then we carry products from Apex Energetics. We have a vanilla or chocolate shake, and some supplements. This is called Hepatosynergy, which means liver, and we're going to clean up your liver and your organs of detoxifications with the shakes and the supplements. It's a 30-day program, and we'll tell you what you can and can't eat in a paleo diet. Everything's in a folder for you, everything that you're going to be allowed to eat and everything that you aren't going to eat. But as I said before, you're going to eat mostly meats, vegetables, fruits, nuts, and seeds. You're going to stay away from dairy, sugars, except for the healthy sugars that we did discuss. We're going to stay away from that. We're going to stay away from soy products and all gluten products and grains.
Okay. And, of course, alcohol and any type of carbohydrate.
Yes, absolutely.
So when I started the detox, I was like, oh, well, I can have yogurt and fruit as my mid-morning snack. No dairy. And one of the things that I did find on the diet was I was eating the wrong fruit. I was eating all the fruit that was filled with sugar.
Right.
So I was eating a lot of watermelon, I was eating a lot of strawberries, and I was eating a lot of apples.
Right.
And I'm talking a lot. So you do want to get portion sizes from Rosemary as well.
Portion control is important.
You know, people will say, oh my goodness, I cannot do a salad without ranch dressing. It's not that hard. It's not that hard. You can make a beautiful salad with any meat that you want. Squeeze lemon juice on it. And like she said, every night if you feel that you need it, you can have a small piece of chocolate.
Yes, dark chocolate. Yep.
Okay. Speaking of nuts, are there any nuts that are bad for a rheumatoid patient?
I'm glad you asked that question, because most people think that nuts Peanuts are nuts. They are a nut, but actually they're a legume. So they're in the bean family, and beans can be very inflammatory to your body, whether people realize that or not. You know, when you eat beans, a lot of times you get stomach upset, you get gas, you get that sort of thing. And a lot of times it does play a role of inflammation. So during the 30-day detox, you're not permitted to have any legumes at that time.
Okay. So you can contact Rose either through our webpage, www.advancedrheumatology.net. It's under Wellness Services, under Nutrition, is all of Rosemary's credentials and how to contact her. Her consultations are $35. She spends an hour with you.
Yep.
You fill out paperwork about, your
Health.
problems, your food cravings, so on and so forth. She has helped people with gene deficiencies. She has helped women that are going through the change of life, and now all of a sudden, they eat, a cashew and they gain 5 pounds. So she's incredibly talented and smart and blows us away all the time. So if you'd like to make an appointment with her, there's several ways to do that. Her contact information is on our webpage. Subscribe to our YouTube channel and tick the notification bell. That way, every time that we do a YouTube forum, you'll get an update. And please also like us on Facebook. All our anti-inflammatory cooking class recipes are listed on our website, again under Wellness, under the tab Nutrition. You can print those out. And once a month, we're uploading new ones. On YouTube right now, we have our turmeric soup, which is very, very good. The cauliflower rice, because, of course, regular rice is inflammatory.
And we just made a summer salad.
We made a summer salad. That'll be on there very soon. And that was a big, big hit here in the office with the homemade dressing. It was fantastic. And everything that we make here is anti-inflammatory. So, signing off from Advanced Rheumatology and Arthritis Wellness Center. And as Rosemary always says at the end of class,
a healthy outside starts from the inside.
Thank you and see you again.